What we didn't get was the coward's compromise that we were all braced for, right? The gaslighting decision that said, we're going to uphold a Mississippi 15-week ban, but not call it overruling Roe versus Wade. No, what we got was basically a word-for-word verbatim of the Alito leaked memo from last month, explicitly overruling Roe versus Wade, explicitly overruling Planned Parenthood versus Casey, and it's got to tell. Because it doesn't even say we're explicitly overruling these cases to send it back to the states. It says we're explicitly overruling these cases to send the issue back to the electeds in Congress and the states. So for everybody who is out there immediately saying abortion's protected in X, Y, and Z places, it is for right now. But what I want to make very clear at the start of this podcast is even before they got to the nuts and bolts of the analysis, right? In the table of freaking contents, Alito shows the full hand. This isn't sending abortion back to the states. It's the first time in this country's history that an unelected majority of Supreme Court justices have taken away a fundamental constitutional right.
She is the senior editor of law and policy at Rewire News Group.
I've thought for a while that this was going to be one of those big cases that the court doesn't release until the last day of the term, thinking end of June. And I don't think that is going to change. But what I think this does is it allows conservatives to sort of soft launch a Roe reversal and to sort of figure out what the backlash is going to be and to perhaps wait for that backlash to dwindle so that when the official opinion is released in June or whenever it may be released between now and then, the country will have already gotten used to this sort of post-Roe world where Roe is reversed.
Here today because I am angry. I am angry because an extremist United States Supreme Court thinks that they can impose their extremist views on all of the women of this country, and they are wrong.
Yes. We're out here fighting for our lives, for an opportunity to make decisions about our health and our well-being. I am an OBGYN and I'm an abortion provider here in DC, and I know that access to abortion care is critical for our communities. It's critical for the people that I take care of, and it allows them to make decisions about if, when, and how they build their families in the way that they know is best for them, and I trust them to do that.
A woman decides I'm angry because we have reached the culmination of what Republicans have been fighting for, angling for decades now, and we are going to fight back. I am angry because of who will pay the price for this. Yes. It will not be wealthy women. airplane. They can fly to another state. They can fly to another country. They can get the protection they need.
No one should be scared to be shot in their classroom, and no one should be scared to die on a maternity ward table. We need practices in place that'll keep the health of Americans safe and not put us in more harm's way. The fact that there can be an AR-15 on the sidewalk, but I can't get an abortion in a private medical setting is absolutely ridiculous to me. And I believe that if the SCOTUS wants to put more rights into guns than a human's body, then that is completely absurd.
We, of course, have lived with the indignity of Congress restricting our use of local dollars for abortion care for women of limited means. So we know we are particularly vulnerable in D.C.
This will fall on the poorest women in our country. This will fall on the young women who have been abused, who are victims of incest. This will fall on those who have been raped. This will fall on mothers who are already struggling to work 3 jobs to be able to support the children they have.
It throws everything into question. I think one of the challenges with advocating for access to abortion care is that nobody thinks they need an abortion until they need an abortion. And so what that means is that many people aren't prepared to navigate the challenges that come with trying to access abortion care in a healthcare system that is not designed to support it. And so from trying to raise enough money to be able to get your care, from finding child care, to be able to care for the children you already have, time off work, transportation, logistical challenges, when we eliminate access to this care state by state, individual by individual, what we know is that entire communities will suffer because of this. And for folks who are already marginalized from care, for individuals who already have challenges accessing reproductive health care more broadly, they are really going to feel the brunt of these restrictions more so than many others.
We cannot underestimate how profound the impact will be of this decision.
Obviously, we were expecting this decision for a while now.
Yeah.
I know a lot of orgs like yours have been preparing for this moment.
Yeah.
How are you feeling now that it's here?
I've been trying not to cry in all these fucking interviews. Sorry. I can't not cuss in interviews.
I came for the Roe v. Wade. I came for the Supreme Court decision that ultimately overturned Roe v. Wade to protest. I knew it was coming, but it hits really hard.
We're just discussing that about the Supreme Court. They have either or. They have roll to the next one. Is it going to affect Clarence Thomas? So what did you accomplish? Republicans, Democrats, what did you accomplish?
I keep thinking about all of the people who are trying to get abortions today, people who are trying to provide abortions today. Tomorrow is a big abortion day. And so I just keep thinking about them because I know what it was like to have to have waited the days from when I found out I was pregnant to when I actually had my appointment, and how painful that wait was. And I cannot imagine what it would have been like if they had to call me and tell me that my appointment was canceled and that several of the next states over I would not be able to get an abortion.
You know that this is going to disproportionately affect Black, brown, and trans people, that they're going to be criminalized at higher rates, and that they are going to die at higher rates.
I think a big part of it was I was always honestly more the type to be like, go vote and that sort of thing than to do the protest thing. But like you've heard a lot of people say today, we did that and they didn't do shit. So it's kind of like, what else do you do? At some point you have to just come out and do something.
What brought me out today was this ruling by an illegitimate, radical, and compromised Supreme Court that is out of step with everything. Frankly, we have a member of the Supreme Court who has ties to a failed coup and who doesn't think he has to recuse himself from cases involving them. We have 3 justices who lie about their positions, and yeah, it's frankly just this is not tenable. This is we're headed toward a kind of state of permanent minority rule, and that's not sustainable.
I'm hoping that people won't go about business as usual. I think that's what the court and Congress and all these folks are waiting for. I think that the Democrats need to get real and get aggressive and get serious about human rights because the Republicans have an agenda. They are aggressive with it, and they are pushing their agenda quickly, and they are stripping rights one by one.
And I just wish people would pay attention. I'm so mad that this is what it took for the President of the United States to even say anything. We asked him for over a year to address this crisis, and he waited until it was over to say something. Are all of us who have abortions not the American people? Do we not deserve his protection and his support and him to stand up for us? This is what it took for you to say or do anything? That shows you how deep abortion stigma goes. That he waited until it was gone to even say anything. Could you imagine if he did that with any other public health disaster, national disaster? If he waited until COVID was over to finally say something? We cannot depend on those in power to show up for people who have abortions. All we've ever had for 4,000 years is ourselves and our providers. And it is so important that we show up together in this moment because we're all we've got.
I think that, social media has been a very good platform for a lot of youth organizations and movements to rise up. But I would say, in order to empower youth, we need our adults to also help amplify our voices. There's so much we can do, by ourselves. But I definitely think being able to work in coordination with our elected representatives, for example, whose jobs it is to make sure that this doesn't happen, that they're working with us and that they know that we're here and they're hearing our voices and they're making the decisions that need to be made.
Well, I am here because I am angry, and I am here because the United States Congress can change all of this.
Yes, it is.
Angry, but committed.
And I'm just really afraid that the options for me now are be forced to have a child against my will or spend up to my life in prison. And it's a really scary reality to look at. There's a lot of fear.
Get into the fucking streets!
Because in my home state, it's going to be criminalized, and that means up to life sentences in prison for abortion providers, and I'm fairly certain they're going to extend that to pregnant people.
It's absolutely horrifying, and it's really hard because I think a lot of people think that this is a game, and it's just like, oh, well, it's just abortion, but if they can take away your ability to decide if, when, and how to grow your family, what else can they do?
Yeah, and to everyone else, I think a lot of young people are definitely feeling like, well, we voted, we campaigned, we knocked on doors, and this just happened. And I don't disagree with that. I don't disagree with that sentiment. I'm really angry. I'm not really angry at the Republicans because I expect this from them. The Democrats, it hurts. It's a betrayal. They can't just keep expecting us to sit idly by because the other option is worse. And I just to all the other young people who are scared or want to act, keep fighting. Community organizing is all we can do right now. I wish I could be more hopeful, but that's all I can say right now.
What will they do? They passed the abortion ban. This is what they wanted. This was the plan. I would hope that Texas would codify the right to abortion. That's not going to happen.
And I think what's scary about this is that we know that people are still going to have abortions. They're going to travel for their abortions. They're going to self-manage their abortions. But what's actually going to happen is that people are going to be prosecuted for their abortions, but also any of the outcomes of their pregnancies, whether it's stillbirths, miscarriages, or anything that's not deemed a healthy pregnancy.
I would love for them to pass the Women's Health Protection Act, but again, I don't think that's going to happen. I'm not feeling very optimistic at the moment.
And I think about historically, combined with the Supreme Court decision that came out yesterday about that you have no recourse against police if they use statements before you're Mirandized. Pre-Roe, what police used to do was take the confessions of people who were suspected of having illegal abortions, telling them that they were dying, getting them to say all the things. They weren't Mirandized. And then that was used in court against them and to prosecute providers. And so I think what's really scary is the way in which we're going to see the fact that people talking about their abortions or offering information about abortion is going to be criminalized. We've seen that the National Right to Life is hoping to do that.
Understand this. I have seen the world where abortion is illegal. And we are not going back. Not ever. No. So say it with me. We are not going back. Not ever. Not ever. Not ever. Never.
Without abortion, they received urgent, necessary, and safe care with her provider in Texas. This time around, however, providers throughout the entire state would not and could not help her for fear of going to prison. The landscape in Texas has changed. Because it was now illegal to provide this essential part of women's health, many providers had left the state, leaving all of reproductive health care impacted. Every step of her care took longer.
Leaving my home state, my family, my support system behind for such a serious procedure was awful and an experience I do not wish upon anyone.
Women, people of color, pregnant people, LGBT community, and those living in poverty especially knew how critical it is to have reproductive and bodily autonomy. And these are the same people who are being hurt the most. Soon after the decision, we began to hear horrifying stories. Stories of people who can get pregnant left on the brink of death as hospitals refused to allow doctors to provide life-saving care until a lawyer was consulted.
Angry. It leaves me completely, outside of being baffled, I'm angry because these are communities that I love and care about and work within. And outside of that, it's really hard to be a protector of women and protector of people and not want to see equity, especially in our healthcare system where it is already so lopsided already.
I did my medical school training in Texas where abortions were already outlawed due to SB 8. And so when making the decision to pursue residency, I knew that I wanted to go to a state where I would be able to provide the full spectrum of obstetrics and gynecology, and that included abortion. So I knew that I had to leave my home to do that, and I expected that I would have to leave my home to do that. But at the end of the day, my goal is to get back home and provide all the abortions I can for my fellow Texans.
A patient was referred for pregnancy due to birth control failure. She has cancer, and her doctors won't give her chemotherapy while she's pregnant. The hospital won't allow termination despite having documentation that it is to save the mother's life. She can't afford to find treatment elsewhere, so she's not receiving this potentially life-saving treatment.